We are live.
Warm greetings to our esteemed Fogsi President Dr. Sunita Tandulwadkar, our distinguished guest Dr. Bharat Rawat, and to all our viewers joining us today. A very good evening to each one of you. I extend a heartfelt welcome to another enriching episode of Gyan Pravah, a podcast series envisioned and initiated by our dynamic leader Dr. Sunita Tandulwadkar, President of Foxy 2025. Gyan Pravah. It means the flow of knowledge. It was conceptualized to offer a distinctive platform for meaningful conversations, not only within the realms of the medicine, but also exploring insights beyond it. This initiative continues to inspire and engage, fostering learning and dialogue across the disciplines. I, Dr. Jyoti Banglowala, Chairperson of Ethics and Medical Legal Committee of Foxy, am delighted to host you today's episode number 189 of this acclaimed series. Joining us today is a remarkable figure in the field of cardiology and preventive health, Dr. Bharat Rawat, a name synonymous with heart care, holistic wellness, and community empowerment. My sincere gratitude to our visionary president of Foxy, Dr. Tandulwadkar, for creating this opportunity, giving platform to us chairpersons, allowing us delve deeper into diverse dimension of knowledge and growth. Dr. Sunita Tandulwadkar, a name, it says legacy of possibility. She is trailblazer, visionary. She is healer. Dr. Sunita Tandulwadkar is not just a name. She is force redefining reproductive medicine in India and beyond. From pioneering the world's first stem-cell baby at age of 45 to shaping national medical policy as president of Foxy 2025 and representing 46,000 of gynecologists across the country. She is the president-elect of
Jyoti,
ISAR.
please.
Her
Today
leadership.
is your day with Dr. Bharat, sir. And people
No,
would
just two
like to
lines,
know
madam.
about Dr. Bharat more.
Just two lines. Her leadership has inspired generations. As the founder of Society of Ovarian Rejuvenation, she has opened new doors of hopes. Through the visionary initiative of Sampurna Preconceptional Care, she is dedicated the upliftment the lives of women across India, not just medically, but holistically also. Her approach blends science with souls, embodying the belief that true care begins even before life is conceived. As a visionary leader, she doesn't just offer solution, she creates pathways. As a true leader, she believes in creating opportunities, fostering empowerment, and nurturing us with compassion, knowledge, a touch of spirituality. Madam, with utmost respect, I invite you to say a few words today.
120 seconds you put on me. Jyoti, thank you so much for your kind word. I don't know whether I deserve, but I log in every day, Dr. Bharat, to just, I should pronounce Bharat or Bharat, sir?
Bharat.
Huh. Just to show the respect to the personality, the faculty, because they have come on a Foxy platform. And it's very important that Foxy president joins them, welcomes them. But then I just join to the viewers link and give the platform to my chairperson to be in one frame with the faculty. That the moment they cherish, I know that. Initially, I thought these are all future leaders. By interacting with the various faculty, they will learn a lot how to share their dialogues, the creativity, the vision, how to interview the leaders. But believe me, sir, today is 189. Imagine I met 189 faculty. They may be from the academic or non-academic background, the spiritual personality, the politician, the film personality, so much to learn from everyone. And I think I evolved myself more. I feel like I should be meeting everyone in person sometimes. And it's just the interacting for 2 minutes may not be enough because you all are of that stature. So when we will have a dialogue with you on a different level, it will be great. So definitely I'm looking forward to see you sometimes in person to know more about you, to know more about, and just to have your own personality to widen. First of all, thank you so much. And Jyoti, you are the chairperson par excellence. When I still remember the days when you were moving around for the election of chairperson, I met you first time in some Kerala all state conference in some of the resort where I was going as a Foxy presidential election. I thought ये लड़की क्या करेगी, अपने आप में ही रहती है, मैंने ज्यादा कभी डायलॉग नहीं किया है, फोटोज वगैरह में बिजी रहती है. बट सर, आई एम वर्किंग विथ हर दिस ईयर and I find that this lady is committed, dependable. Spirituality is in her blood. What is important, in an organization, you take a chair, but you need to do the justice. You need to give a time. You need to be committed for your responsibility. And Jyoti, anytime, even I send you for the government meetings because you are in a law force, I always find her within 24 hours, such a short notice, and this girl goes. She attends that. So, Jyoti, you have a huge future. More than you needing the position, higher position, Foxy also needs the leaders who can perform, who can take the organization to the different level. So I definitely wish you all the best for your future endeavors also. Thank you. Thank you.
Thank you, madam, for your kind words. Actually, we are just learning from you. When I told Dr. Bharat that every day you join at 8 p.m., he was just thinking how it is possible. So this dedication comes from the leader, madam, and we as a small, actually, as a small.
I don't feel I just start the program and I make them do on their own and then without bothering, it's going on auto mode. That is not right.
No.
Joining for the faculty, showing the respect to the faculty, acknowledging their presence on a Foxy platform is very, very important. I feel this is
Thank you.
my way of just, giving to this program.
Thank you, madam. Thank you. So now we are coming to our guest speaker. He is born and raised in Indore, Dr. Bharat Rawat. He pursued his MBBS and MD from MY Hospital and then later completing his DM in cardiology. In 1998, under the guidance of Dr. Naresh Trehan, he and his wife embarked on the transformative mission to establish Nepal's first cardiac hospital in Kathmandu. What followed was not only a thriving medical practice, but a profound social impact that touches countless lives. Now back in Indore, Dr. Rawat continues to serve as a senior cardiologist and lifestyle guide at Medanta Hospital, while also pioneering community health initiatives. He founded the Indore Heart Club, a free public social network with over 15,000 members dedicated to sharing simple, powerful tips for a healthy heart. Beyond medicine, Dr. Rawat is a passionate advocate for physical fitness, environmental well-being, and the power of reading. His monthly book review sessions are open to all, fostering a culture of learning and reflection. He has authored 2 acclaimed books, Healthy Life for Healthy Heart and Dil Se Dil Tak, with a third on the way titled Accepting the Disease and Living with a Smile. Dr. Rawat believes that an honest and simple life keeps our heart fear-free, and a fear-free heart is often a disease-free heart. Today, we explore his extraordinary journey from hospitals to heart clubs, from stethoscope to storytelling, and discover how one man's mission is healing hearts, minds, and communities. Dr. Rawat, let the stream of wisdom flow. Welcome to the Gyan Pravah, and we will be happy, as you said, to sit and talk to you about the ladies' health in general. And then for our Foxy members, though this Gyan Pravah podcast series, it is not only meant for the doctors, it is actually on the YouTube and the Foxy platform. So the non-medical person also sees. So we are just asking you a few questions about your journey and for the women health in general and what your journey to the Indore Heart Club. Though you are everybody knows that you are a senior cardiologist and still you are just telling your patients, dawai mat khao, just go to the holistic lifestyle, just go to the simple lifestyle. We just all want to know about you and your journey. Welcome you on our Foxy platform.
Thank you, Dr. Jyoti.
Just you want to say something to madam, then madam will leave actually.
Now, of course, Dr. Sunita and Dr. Jyoti, this is an absolutely fantastic opportunity. I think जैसे आपने कहा कि आपको अच्छा लगता है, मुझे लगता है कि किसी भी गेस्ट को भी बड़ा अच्छा लगता है कि इतना अच्छा प्लेटफॉर्म आपने तैयार किया है और it is so nice that you personally appear for some time and to welcome the guest speaker and before you take a back seat. And of course,
Thank
Dr.
you.
Jyoti, my batchmate, is a star of our batch. And it would be nice to talk on a podcast today for the first time.
Thank you, sir. You must be knowing since you are cardiologist, Dr. Grant from Ruby Hall Clinic.
Yes, yeah. He also knows me. I also know him. That's right.
Yeah, so I am in Ruby Hall for last 30 years. I head the OBGY department. I am chief of IVF endoscopy at Ruby Hall. And Dr. KB Grant and now Dr. PK Grant, I'm one of the most favorite consultant, probably because I'm the highest operating surgeon of Ruby Hall for last
Okay,
30 years.
lovely. Great. We'll catch up sometime.
Yes, sir. Thank you.
Madam is having the good two projects actually Eagle. One is Eagle and one is the Sampoon. But what I told you about the women and even for the student of OB-GYN. So just start with the formal introductory questions. Uh, just just to ask you a journey. What inspired you to pursue cardiology or then after cardiology this lifestyle coach? Just share.
Jyoti, it so happened that one of my uncles needed angiography some, maybe in 87, 88 when we were in third year MBBS. And we had to take him to Mumbai. And after his angiogram, he needed a bypass surgery. Around that time, there was a conference happening from Rochester Mayo Clinic at Bombay Hospital in Mumbai. So I was third year MBBS student, but I somehow requested Dr. A.C. Pereira and Dr. B.K. Goyal, the organizing people there, and they allowed me to attend the conference. And I attended the full 3 days, 4 days cardiology conference when I was third year MBBS. I knew that this is the area I want to specialize. So that is how I went into cardiology. Now, lifestyle is, I guess, that is a journey that happened much later, frankly speaking. So, like any other cardiologist, I was also an aggressive interventional cardiologist. और हम हमारा सारा emphasis नई टेक्नोलॉजी को शुरू करना और प्रोसीजर्स करने में रहता था. But then slowly I realized that sometimes we were overdoing things and not everybody was able to afford it. So I slowly realized that it is very important to make a balance. So I still do procedures, but I know that many patients, they just need some simple healthy tips. And that is why the Heart Club came into picture.
So how do you see your roles as a means they are overlapping your lifestyle as a lifestyle coach and as a cardiologist. So when it comes to the patient care, how it when it overlaps, how do you do something?
First of all, I think I start from making a change in my own life that that if I am able to live a simple life and with simplicity, a lot of things that you want to do, you can do. But for that, you have to be happy with your simple living. And then you can give a lot of time to your patients. And when you are able to give time to your patient, then you can listen to him and the patient also listens to you. And then, things become more effective. But if you are too busy in the procedures, then sometimes my professor used to say once that as you become busier operator, your prescription becomes poorer. So it's not just the prescription also. Yeah, sorry. So it is not just the prescription, but it is also the amount of time that you want to give to the patient and to understand the patient's personal choices and also give importance to things sometimes which the industry doesn't like you to do. For example, industry doesn't want that you should talk much about diet and physical exercise and pranayam and meditations, but still they are important. So somebody has to give importance to the important things, and a lot of things are not uh, promoted by industry because they cannot be sold.
Yes, surely. And you are seeing, have you ever actually counted the patients? How many female patients are coming to you in a month, and how many male patients are coming to you in a month? Because most of the time, when we visited to any corporate hospital or any hospital in the cardiology department, most of the time we see only male patients in the corridor, and most of the time only daughter-in-laws or daughter or wives, they are accompanying the patient, but mainly the patients are the male patients. So what is the
So,
ratio you are seeing in the
yeah,
Indian
so
scenario?
let me tell you that it is very clear that earlier that was the case, but nowadays the point is that female patients are no less. So the difference would be barely any significant difference. But yes, when they come for preventive health checkups, then the ratio is there's a huge difference. 75% are men, 25% are women when they come for the preventive health checkups. So even husbands who have their wives, they don't feel shy coming alone. कि भाई खुद का चेकअप करा ले, उनके मन में ये नहीं आता अपनी बीवी का भी चेकअप कराने आ जाए. और
So
आपने बिल्कुल ठीक कहा डॉक्टर ज्योति. जब मरीज के साथ में जो लोग आते हैं तो मैं कई बार देखता हूँ या तो लड़कियां होती है, एंड समटाइम्स व्हेन देयर इज अ जेंट्स एंड आई आस्क अच्छा आपका लड़का है, तो मेनी टाइम्स द पर्सन सेज नहीं मेरा जवाई है.
ये तो है इंडियन सिनेरियो है द गर्ल्स हेल्थ और द फीमेल हेल्थ आर मोस्ट neglected part in our country, and nobody is actually, we cannot blame to anybody, we ourselves blame to ourselves. The girl has to, or the female has to take care of their own health. So what are the most common actually heart health issues you are seeing in the female, particularly female?
सो आई वुड से दैट जो हार्ट की प्रॉब्लम्स महिलाओं को होती है, दे डोंट गेट अ टिपिकल सिम्टम्स एज मैन दे डू. सो विमेन में हैव एटिपिकल सिम्टम्स लाइक दे में हैव वे घबराहट एंड एसिडिटी एंड बर्ब्स एंड अनइजीनेस, unusual sweating, breathlessness. So they may not have typical chest pain. And that is why their diagnosis is often delayed. वो होममेड थेरापी पे और थोड़ा सा कुछ ऐसे ही उनका डिले होता रहता है.
So
बट बट
there is
देयरफॉर
something to
yes,
lifestyle of our females.
it is it is very very important to understand that women, I think by nature, they do not want to disturb a lot of other people, in the family members. And sometimes I have seen elderly mothers and aunts, they sometimes feel why to bother our children. And as far as lifestyle is concerned, I think the biggest problems are that they will do all household chores, but they will not do any regular, proper physical exercises or muscle building exercises or healthy eating in the terms of, like, men are very conscious these days about protein eating. But I know I have not seen a lot of women calculating how much amount of protein that they are having. And also, they may just eat leftovers and they may not really go for good quality salad and fruits and other things. So I think in general, women, and also as I said, preventive health checkups, they think that is not necessary. मैं तो ठीक ही हूँ, मुझे जांच की जरूरत क्या है, ऐसे हो जाता है.
So actually, the age is no bar. Post-COVID, we are seeing the huge age differences in the cardiac health issues. But still, at what age we should actually give, means to just start thinking about the all the heart health or all the checkups.
देखो मेरा ऐसा सोचना है कि once you are around 25-30 years, you should have at least baseline sugar, lipid profile, and blood pressure checked, and maybe one ECG. And at some point of time, you should do your echocardiogram. Now, depending on your family background and the results of these tests, your doctor will then further guide, do you need a stress test or any other test? But for sure, once you touch 40, these tests should be done more regularly. And you should have a trust on a local physician. And you should follow the physician's advice. And you should be in touch with the physician. It is a blind faith that you need to have to your family physician who knows your background, who knows your family history, who knows your habits, who knows your financial state, who knows your emotions. I think that family physician role is very, very important.
As Sunita Madam told us that Sampurna preconceptional care, we came with a passport where they are saying about hemoglobin, blood group, weight, BP, and sugar. So same the cardiology department also can do with a passport. With every patient, they should actually do after 25, they should know about the few simpler tests, just like you told us. Few simple tests that should be mandatory because early you pick up the disease, early you can just prevent them.
Absolutely.
So is there any importance, is there any role of preventive cardiology? Just you can say.
So these are the important tests to know what is your baseline risk. Okay. And if the risks are found, then of course you can improve your lifestyle. And occasionally you may need a pill. जैसे अभी आपने कहा कि you have this passport and you have this baseline test. So I think the two most important things as far as heart is concerned would be sugar and blood pressure. I really request everybody who is listening to this that please, for God's sake, check your blood pressure and sugar tomorrow and ask everybody in the house to check BP and sugar. These simple tests also sometimes we think we have just checked, but it might have been already few weeks or many months, and you might have forgotten that you have not checked your blood pressure or your sugar. Even those who think that don't have blood pressure or sugar, they should keep periodically themselves checked. Today, almost one third adult population in India has high blood pressure and one fourth have high sugar levels. Pre-diabetic, if you include, then they are almost one third again. So it is very, very important realization that how important is to do a preventive checkups. But you don't need to spend too much money. That's what I want to say. Not everybody needs to do a CT angiogram. Not everybody needs to do treadmill test or echocardiogram. But at least basic blood pressure and blood sugar test one should.
Actually, everybody understands there is a important role of nutrition or fitness or stress or sleep cycle or even the emotional well-being. But everybody just reads it and then forget it. So how we can just tell our patients or our family friends or our colleagues to just what type of role actually diet plays in the cardiac health? Because
See, it is very important to understand that your food doesn't enter your mouth and stops there. It enters your body and everywhere, every organ of your body. खाने के लिए जीना है कि जीने के लिए खाना है? This is a very important basic question that everybody needs to answer. Now I know that a lot of people love food and Dr. Jyoti is no exception, I guess. But I also know that one can stop at small bites. You don't have to finish the entire thing. Also, Dr. Jyoti, because we are talking mainly to women here, I have one question to all women that what is the source of love and respect other than offering food to your in-laws and to your jawai? Your son-in-law and your brother-in-law, जिया जी मेरे हाथ से तो एक लड्डू खा ही लो, जवाई साहब हमारे हाथ से और एक बाफला खा ही लीजिए. you know you have given your daughter, you have given your sister to this man. Why you want to give him disease now? So I think all women should also understand today that this is not token of love. It is a token of disease that sometimes you are offering to your family members. Yes, if you have made something by yourself, it is a homemade item, not rich in sugar, I think it is fine. But if you have ordered something from shop and that item you want to force to your own family members or children, I guess we need to learn something from them.
yes, actually, just Dr. Sunita's son. Last time when I met them, I just offered some Indori namkeen, and he straight away said, "Ki madam, we are just not taking any packaged food." He said, "No, madam, whatever you made in the home, we will just accept it with love. But if you are offering with some ready-made item like sev and namkeen and Indori mixture, I'm so sorry, I will not take it." That was one thing I just learned from them, and that actually this is the first step towards our heart health. Is there any special food we can avoid
Yes.
or any special
Yes.
foods we
Yes.
can just
Yes, Dr. Jyoti, I will like to answer this question
yes.
because women are most important source of food for everyone else in the family. So they should clearly know that what is heart healthy food in general. So the first answer, of course, we have talked homemade food. The second would be early light dinner. So dinner should be early. I hope everybody has taken food already. Number three would be have more portions of vegetables and fruits. So you please reduce cereals. जिसमें गेहूं like wheat, रोटियां, we should decrease the number of rotis and we should eat more. We should use less oil. Most vegetables can be cooked with minimum oil or no oil, and even they taste very good. You don't have to really put too much oil. Then I would say please avoid trans fat. Now, what is trans fat? Trans fat is the fat which is adulterated by something like dalda ghee, because that is a hydrogenated fat, which is a cheaper kind of ghee looking like substance, but that is not pure ghee. That is dangerous. Similarly, a oil which is repeatedly heated, it becomes trans fat. So you go to any vendor और भाई कचौरी लेके आओ, तो वो he will never ask you, मैडम रुक जाओ जरा नया तेल डाल रहे हो, नया तेल कभी यूज नहीं करेगा. So he is using the same oil and repeatedly heating it. Now that becomes trans fat. So trans fat is dangerous for your heart. Sugar intake should be reduced. तो मैं इसको कई बार ना हिंदी में इस तरह से कहता हूँ, खाने का सामान खेत से मंगाए, किचन में उसे पचाने योग्य बनाए, फैक्ट्री का सामान घर ना आए और घर का बना हुआ चाव से खाए. यही है यूनिवर्सल डाइट जो कि ये सबके लिए राइट.
Thank you very much. Actually, there are so many, means now this is a trendy things to just hire a dietitian and take a means a variety of diets, and there is a new trend of taking Mediterranean diet. I just want to know about what is the difference between the Indian diet and Mediterranean diet, and what we can do with our own Indian diet.
I
Because हम
think it is
गांव के
very
आदमी को नहीं बोल सकते आप Mediterranean
absolutely,
diet.
absolutely. I think there is absolutely no need to look here and there. But the only thing is आप बहुत ज्यादा उसको रिफाइंड मत करिए अपने फूड को. जितना नेचुरल फॉर्म में है उसको मिनिमम बस डाइजेशन के हिसाब से उसका कुकिंग होना चाहिए. So it is very important that food is made at home with minimum amount of alteration, और vegetables and fruits जो seasonal है वो हम खाएं. The seasonal food, the seasonal vegetables. Don't have to buy expensive ones. Those which are smaller ones, those which have some spots, कुछ दाग लगे हुए हों, जिनमें बेस्ट क्वालिटी का स्टिकर नहीं हो, those who are easily available on all shops or ठेले वाले पे, I think they are good because possibly they are organic. And those which are good looking, large size, beautiful looking, shining, expensive, not easily available, they are possibly not so good. Similarly, I want to tell few items which can be used particularly as a heart healthy food. Number one would be in my list will be fish, if you eat fish. Okay, I don't eat fish, but those who enjoy non-vegetarian food, they should know that fish is one item that possibly is good for heart. For vegetarian people, omega-3 fatty acid, the best source would be flax seeds. So I request all of you to consume 4 to 6 teaspoons of flax seeds every day. So that is what I keep in my office also. You can roast them. You can also mix some other seeds or small pieces of maybe almonds or something like that, so that they become easy to chew. You can grind them and mix them in your atta. You can also have extra virgin olive oil that is used for dressing and not for cooking. That is also a good source. So I think these are few good food items that one can consume. In general, I am not a great proponent of milk or dairy products. even though I think there are two dairy products which are possibly okay and good for our health. One would be small amount of curd, and second would be maybe a pure ghee, 1 teaspoon of pure ghee a day. So barring this, one can avoid drinking milk, and also चाय का मतलब होना चाहिए डॉक्टर ज्योति गर्म पानी और चाय की पत्ती, एंड कॉफी इज गर्म पानी एंड कॉफी. उसमें दूध और शक्कर किसने डाला मुझे नहीं पता.
Actually, just it is just as you are saying, we are going to our, if we go to our grandparents' days, these are the things we are eating in our childhood, and now the everything is adulterated with the so much market values and everything. So this diet part you have just taken care about very well.
There's
Now,
one more thing I want to convey if I can.
yes.
मुझसे बहुत लोग पूछते हैं why there are sudden deaths amongst young people these days. One of the reasons is, of course, we know pollution, lack of sleep, and continue to, smoking and all. But a very important thing is plastic overuse. So they have now confirmed that there are chemicals called phthalates, which are used to make a plastic moldable. And when you use this plastic container for your food, which is either hot or oily, then those chemicals they leak into your food and they can cause heart attacks. What is the evidence? Lancet, one of the most reputed medical journal, 3 months ago published an article where it showed that in 1 year around the globe 350 more than 300,000 deaths occurred because of heart attack because of this plastic use, and out of them one third were in India alone. So we lost, Dr. Jyoti, more than 100,000 lives in 1 year because people are using left and right plastic containers for their eating food. So now imagine when boys and girls do not want to cook, where do they get their food from? Which Zomato or any other vendor would serve you in any other form other than it has to have a plastic there, right? So
Yes,
that is a
so
miracle.
actually, previously we were taught about just to reduce the environmental pollution. Everybody was saying just keep one katori and one glass in our own purse and use that. So it is our own thing. It is not actually adulterated with anything, any no infection. Even for the airports, we keep one small glass in our own purse just to just take the water from the tap. So there are so many things, few small things we can do. And just like the diet part you took, but just sleep is often overlooked part. And see, there are so many people, even our own sons and daughters, they are doing very long duty hours. So what is the connection of the sleep cycle with the heart health? Because the chronic stress and chronic sleep means deprivation, every doctor cardiologist says it is a connection between the sleep and the stress with the heart disease. So how does you actually just elaborate this
So
thing?
there are a lot of factors which cause inflammation in our body, you know, for many sources. And all the recovery that occurs in the body mostly occurs in the night hours. And therefore, good sleep for at least 6 hours, relatively uninterrupted, most days a week, is very important for our overall health. जिन लोगों को खर्राटे आते हैं, so snoring is also a problem. One should not consider snoring as a sign of good sleep. So loud snoring can increase blood pressure and can cause heart failure and stroke. So अगर यहाँ पर कुछ ladies सुन रही हैं and if your husbands they are snoring loud, I think you need to tell your doctor and get the sleep study done. And yes, if the sleep issue is a problem, if there's a problem with the good sleep, I think everybody should see a psychologist and if needed, could do some counseling or a proper treatment. But before that, one should take one's own measures like early dinner, staying away from screen, and some regular physical exercise. One can keep the room pretty dark and maybe do some prayer before you sleep or read some light thing before you sleep. I think few of these habits can help.
There are young generation, actually, our even young doctors in our residency days, there are sleep cycle disturbances very common because there are so many people, they are doing the night shift nowadays, they
See,
are
for
working for
some
the MNC.
time, yeah, for some time it happens, night is all right. It shouldn't happen for weeks together, months together, years together.
If someone is doing duty for the night shift only,
Yeah,
if
so he
he,
has to eventually think, I tell my patients, you are okay when you are 30 years, 35 years, but you cannot continue when you are 45 and 55 and 65 years. So at some point of time, you need to change your job, even if that is important.
so is there any role of the mental well-being or mental health in the cardiovascular, overall cardiovascular health is connected to mental well-being? Is there any role?
So my answer is yes and no. No, why? Because directly, no study has proven that stress can cause heart attack. But indirectly, stress can surely cause heart attack by spoiling your lifestyle.
Okay.
So, a lot of things that we are discussing today is known to everyone. And despite knowing, if people cannot follow, it is because they are not completely in a relaxed mode. So, if we are completely in a relaxed mode, then it not smoking and not going for late night dinners and getting up early in the morning and do pranayam and exercise and yoga, I think it will all become easy. But if you are stressed out, then everything will become difficult. People smoke and drink alcohol more when they are stressed out. So I think that is the connection between stress and heart disease.
Actually, you just stressed upon the fitness, diet, sleep, mental health. But is there any one you can say most effective but underrated lifestyle change? Because घर की मुर्गी दाल बराबर जैसा ही है कि घर का खाना सबसे बेस्ट है पर घर का खाना नहीं खाएंगे। बर्थडेज हैं, एनिवर्सरीज हैं, हम होटल में खाना खाने जाएंगे। किसी को पार्टी देनी है तो हम बिल्कुल किसी होटल में जाएंगे, घर पे बना के नहीं खाएंगे। इसी तरीके से देयर मस्ट बी समथिंग यू आर जस्ट thinking about this. This is the underrated thing, but if we should do, then it is having the big impact on our heart health. Is there anything you can say?
Simple living.
Okay, yes.
I tell you, the moment you realize that the outside world is not all that real, important, essential, and if somebody could convince you that you don't need to really win the outside world, and you are fine with your small house, with your few family members, with your few friends, with your smaller car or vehicle, with your uh, small little world, and you don't need to win the outside world. I think the moment you can convince yourself this, a lot of good things will fall in place.
Contented, happy life, actually, you just want to say. So there are so many people, they are struggling with the, just I told you, if they are, the person is having the continuous night duties. So they are if struggling with the sustaining lifestyle changes. How do you help them with your, when they are coming to you for consultation?
I talk to them a lot, and I tell them that please come with your family. They are married with their wives, and they need to sit and discuss, maybe sometimes with the children, that okay, what is the role that the rest of the family expects. So maybe they should slowly work for their satisfaction and not for making another house or another property. I think that changes everything.
So, in our vicinity, in our central India, everybody is knowing about your indoor heart club. We also actually experienced many a time that you made a heart club for the just awareness, and you are giving simple tips. Even you are the person who is not just telling you, just not narrating. You are yourself is doing everything, and then you are telling to the people to do. You yourself, I saw you doing just simple living and this healthy living. So beyond this particular 7 8 years of journey of this lifestyle coach, have you seen any can you share us some story of any person who when come to you for the counseling or for the treatment and totally changed after your motivation, after your counseling, through your lifestyle modification?
So, Dr. Jyoti, now I'm happy to inform you that this used to happen once in a while that somebody would come and tell me this. Now this happens almost every day. So I'm telling you, it is so nice when people come and tell me, डॉक्टर साहब अब तो हम आपसे सिर्फ मिलने के लिए ही आ रहे हैं. अब तो दवाइयाँ तो आपने हमारी बहुत कम कर दी. And it is nice to see that the people now are getting convinced that they don't need to uh, resort to expensive treatments. But yes, it has to be a balance. Even now, I do write medications. Even now, I do procedures when it is needed. बट आवश्यकता से कम उपचार ना हो, आवश्यकता से अधिक उपचार ना हो. So Indore Heart Club is like दिल के नुस्खे हर हफ्ते हल्के फुल्के. So every weekend I post, and all your listeners, if somebody can post my WhatsApp number, then if somebody texts me, please send me the link of Heart Club. I can send the link, and they are all welcome. It is free and open to all. I post the messages in Hindi and in English every weekend. So if somebody posts my mobile number, I don't mind. But don't call me, just send me a message. Please send the link for Heart Club, and everybody can join the Heart Club. Similarly, I wrote few books. This is one book that you already have, Dr. Jyoti, that it is in Hindi and English, Healthy Lifestyle for Healthy Heart. And this also PDF is available free for everyone. And I have written it here. There is no copyright. So, so even you can print it with your own name, but don't put my name and change the content. Okay. So, if you send me a WhatsApp, send your book to me. I will send the PDF, and again, it is free, and you can share with others also. So I think knowledge should be not charged, and if anybody can get motivated by these simple facts and avoid drugs and doctors, I think it is good for society.
So actually, as a society level, actually, there are so many interventions that can improve the cardiovascular disease. Just like when we are seeing you as a friend or as a classmate or as a senior, whatever, you can just motivate means us all. But as a doctor, as a gynecologist, how can I do in the community level? Because being a gynecologist, there are so many people, they are coming to me. The women are coming and just saying, कि, Madam, चेकअप के लिए नहीं आ पाए because my father-in-law was ill or mother-in-law was ill. So how can we propagate these things to our patient? Is there simple counseling works or just we have to tell them to just go for the baseline investigation?
So I would say number one would be time. We need to give time. First we listen to them and then make them feel important so that they understand that we are serious when we are talking to them. I think that would make a big difference if you want to convey anything. Because once you listen to them, then their ears are open. And then you speak, then it works. But if I don't listen and I just speak, then their ears are closed. That is one thing I have heard, understood. Second would be, I request that one of you can also start like women health club or something like that, or whatever name you want to put. And then people from different cities can use their local language in different states, and they can also put weekly health tips. So anybody can call me and I can guide how I started. So I started with one WhatsApp group, and I kept the name Indore Heart Club. And I added Anjali, my wife, into that WhatsApp group. And then I shared that link with others. In 2 years now, there are 15,000, 16,000 members. So, because everybody wants to join. So there are 16 groups now, because one group, about 1,025 or something people can come. So this is what happens. And then we do periodical 3 or 4 meetings in a year, physical meetings, in which I invite all the cardiologists of the city from different hospitals on the stage, and don't allow anybody to do marketing, either self marketing or hospital marketing, not allowed. You only give nuskhas, tell what you are yourself doing, tell your story. And around 500 to 1,000 people come physically, and families and the patient parties and the families. And we have those 3 or 4 meetings in a year, physical meetings. And weekly, we give health tips. So this is, I think we can all try. But I think the most important thing would be if we can give time to the patient.
Actually, it is a very courteous and very righteous way of this media and everything, because WhatsApp is not only for the entertainment. This is the good way to just communicate our things to the patients. And this is the era of gadgets. So how can means we just how do you see the rise of fitness trackers or the health gadgets or health apps for means, the cardiac health? Is this helpful for the patients or this is the
That's a great
overused,
that's a
overrated?
great question, Dr. Jyoti, and I would say it has definite some value. Because it will tell you, आपको ऐसा लगता है कि आप रोज 5 किलोमीटर वॉक कर रहे हो. But if you see the average that your phone tells you, over last 6 months, you might be ashamed that that was nowhere close to 5 kilometers. You walk 5 kilometers twice a week and you feel like मैं रोज चलती हूँ, है ना? आप 10 दिन चले एक महीने में और आपको ऐसा लग जाता है कि मैं रोज चलती हूँ. See, my wife is not very happy right now when I'm saying this. So I think it tells you, it gives you the hard fact कि आप चीज क्या हो, exactly आप कितना कर रहे हो. So I think that way it is good.
So, and the supplementation,
Oh
nowadays,
no.
everybody, no.
No.
No
I personally, as I'm slightly anti-industry person, and I feel that if you are needing to take supplements, maybe you are overdoing your exercises. So अगर कोई आपका बच्चा को ऐसा लगता है कि उसको प्रोटीन सप्लीमेंट की जरूरत है, maybe he is overdoing things or he is not realizing that even at home you can have good amount of protein. Like you can have not one katori dal, you can have 3 katori dal. You can have tofu, and you can have sprouts. So something like that can take care of your protein requirement. And even if you are not eating animal products, but if you are eating animal product, then there is no problem. Similarly,
Yes.
vitamins and other supplements, unless it is recommended by a doctor and somebody has checked your folic acid was low or your iron was low, or if your vitamin D or B12 is low, then it is different. Otherwise, routine supplements should not be taken.
Actually, supplementation nowadays we are seeing a very young age group girls. They are coming with the vitamin D deficiency. It is not the insufficiency, the deficiency. They are not going to the sunlight. They are not going to outdoor activities. Even not going for the walks. From the early morning, they are going to schools or colleges, then the coachings, and then the coaching, and they are coming home late and the sleeping, eating, sleeping. So this vitamin D is actually playing the very good means the very important role in the cardiac health. So, what you are just advise these girls who are not taking the direct sunlight and
See,
they have
so
to just take the vitamin D.
I would say that if finances are a problem, then vitamin D supplementation can be routinely given. There are many experts who have written articles on this, that if the entire community cannot afford, because it's an expensive test to do, then maybe it is a good idea to just routinely give vitamin D supplements even without checking. So, but if somebody can afford, of course, one can check and then appropriately treat.
So, in the genetic, we are seeing that there are so many genetic labs. They are also coming with the test. They are just telling us just go for the genetic testing just to see what's taught. No, not at
Okay,
all.
so my answer would be, first you take care of 5 gram problem of eating habits, then you take care of 3 gram problem of, you know 3 kilogram problem of your exercise, then your sleep, and then you take care of 2 gram issue of your this genetic testing and all. So that comes only after you have solved all other problems. You smoke and you don't sleep on time and you don't do exercise and you say I want to do my genetic checkups. That's not good.
Is there any role of the financial independence in this cardiac health checkups and everything?
Absolutely, yes. There's no doubt about it. Where is the doubt? I think not only that one should be financially independent, but also one should have some amount of mediclaim, or those who are eligible for Ayushman should have Ayushman. And then you should know that which hospital recognizes them. And also you should know your doctor can be working at Medanta. Like for example, I work at Medanta and my fees is 1500 rupees. But I also work at Cloth Market Hospital where my fees is 100 rupees. And I go to Madhav Shishti Hospital where my fees is 50 rupees. So you can, if my patient asks me, डॉक्टर साहब हम आपको कहीं और दिखा सकते हैं, तो I willingly tell them, and I will see them with as much love and respect as I am seeing at Medanta. So I think every patient should ask the doctor कि डॉक्टर साहब हम आपको 1500 रुपये फीस नहीं दे सकते, अब क्या करें, आप किसी ट्रस्ट हॉस्पिटल, many doctors actually will give some alternative. So आपको पता होना चाहिए, if you can't afford, don't go to 5-star hospitals, go to a decent hospital. And I'm telling that a lot of patients should know that even in small hospitals and public hospitals, good work is being done.
So actually, we are dealing with the women health, and most of the time we just see that women are considering themselves as a very means their own health. They are considering very giving less important than their men or male persons in the home. They are just even I saw many gynecologists. They are just ignoring their health. They are if their husband says something is happening, they just tell the husband or take the husband to the hospital, but they themselves just ignoring the health. Is there any message you want to give to such ladies to just give importance
अगर
to it?
आप अपने परिवार से प्यार करती हैं तो आपको खुद से प्यार करना है. If you want
जी.
to take care of your family members, please take care of yourself first. It's just like they tell you in the aircraft, you tie yourself first your seat belt,
Yes.
and then you help others, and you know your oxygen mask. So you help first, you take care of yourself, and then you take care of others. Otherwise, you won't be able to take care of. So, and also I want to tell, age is not a consideration. You know, many women would think now they are 60 years, 65 years, 70 years. Now they don't need to exercise, for example. My mom is 80 years. She walks 3 to 4 kilometers every day, and then she does yoga and pranayam, and she does weight lifts, 2 kgs of dumbbells. So I guess, women sometimes they don't do enough exercises. And where's the pair of shoes, walking shoes? Where's your walking, suit? And why don't you leave your house? मैं सबसे निवेदन करना चाहता हूँ, please, you should leave your house, whatever it is, take out time and go out. Join a group. Even kitty, I want to tell you, even a kitty thing might be mentally relaxing thing. If you don't eat there, of course, too much. So, don't go to kitty to eat. But otherwise, I tell you, kitty can be a great place of relaxation. And you should have some, this outsourcing, some way to relax yourself. And therefore, get out of your house, even if you are a non working woman.
So when I was preparing questionnaire for you, I just came to know that the CABG and PTCA, this type of all the procedures, they are having bad prognosis in women
That
than
is true,
men.
Dr. Jyoti. Yes, अगर आप bypass operation या angioplasty करते भी हैं women का, so in
जी.
general the prognosis is poorer in women because of multiple reasons. One is that the disease is already advanced. Two is that physical condition is not so good. They were not fit enough, you know. So all these reasons, the it is better that women should take care of preventive aspect more.
So can you share your own personal actually routine to our listeners or audience? Miss, what you do for your own wellness? You just motivate each and everyone, but what you is a general routine of each day of you.
Okay, so my general day would normally start around 5 to 5:30 in the morning. I'll get up. And then I try to do some form of exercise for about 45 minutes to 1 hour, sometimes more. But I would say at least 45 minutes should be minimum. I try to do various kinds of exercises these days. So sometimes I run, sometimes I do Surya Namaskar, push up, plank, weights, and different types of stretching. And I would normally like to have very light break. Like I take my morning black coffee. I love my black coffee. And then I take light breakfast, mostly the tofu or sprouts in the morning before I go to hospital. And then in hospital, my mom and my wife, they would send me lunch box, which has typically one flask of dal, as I said, and vegetables and salad and a small amount of rice. And in the evening around 7:30, we will have dinner.
So
My
if
weak points are also there. It's not that I don't cheat. So I like dark chocolates, not normal chocolate, but at least 75% or 90% dark. And occasionally, especially on Sundays, my mom knows that I would like to eat something, so I eat some homemade sweets sometimes. Yeah.
so any means one important message if you wish to just extend everyone to take seriously about their heart health.
I would say again, I would say please थोड़ा अपने मन का ख्याल करो. मन का ख्याल करेंगे तो दिल का ख्याल अपने आप होगा. So if you think that there are problems, emotional issues, don't shy to see a counselor or a psychologist or even a psychiatrist. Don't shy. It will change your life. Two would be do regular exercise. Some kind of physical exercise will keep you mentally strong. So think about your fitness. कि पहले मुझे 3 किलोमीटर चलने में 40 मिनट लगते थे, अब मैं 36 मिनट में 3 किलोमीटर चलता. First I used to do only 30 seconds plank, now I can do 40 seconds plank. I could do only 10 squats and now I can do 15 squats. So please count your, measure your physical fitness and count them and try to build on your physical fitness. Laugh many times a day. And I would also request, please read some good books,
Yes,
self-help
there
books.
is a reading club also. You are actually leading a reading club also, book reviews you are
Yeah, so
going.
I don't meet people after 6 p.m. these days, Dr. Jyoti. So for almost 5 years now, I don't feel like going to weddings, parties, conferences, meetings, movies. So after 6 o'clock, I'm home and I want to do what I want to do. One of them would be reading. So every month I read one bestseller book in the world. So we have done 45 sessions so far. This Sunday, 10th August, I'm speaking on 21 lessons for 21st century by Yuval Harari. And it is all the talks are available on Instagram and YouTube. And also I post the slides on the group with that book review group. So I post the slides which people can use and reuse. Again, there's no copyright there.
So before just concluding everything, I just want you to share uh, one small action plan for our listener. For from today only, they can start a small action plan.
Okay. Please take early dinner, sleep early, get up early. Don't take shower without doing 2 sets of Surya Namaskar. I think that would help.
Yes, thank you, Dr. Rawat. Actually, these simple tips, they actually it seems very small, but when we start from today only or tomorrow never comes. So today only when we start something, because we are seeing the females are coming with all the diseases and they are actually dependent on their husbands or father or son or brothers. So prevention is always better than any treatment. So from today only, we just myself also motivated listening you and
Good.
these three things: eat early, sleep early, and do some exercises. Actually, great thing. Thank you, and we hope you will come again on our Foxy platform. And we thank again to Dr. Tandulwadkar for giving us this platform. Thank you again for just obliging us and coming to this Foxy platform and sharing your small tips.
Thank
Thank
you
you.
so much, Dr. Jyoti. It was very nice to talk.
Thank you. Thank you. Thank you very much.